Hello, I'm Mickey Smith. I'm one of the neurosurgeons at Houston Methodist, the Woodlands Hospital, and today we'll be talking about mechanical thrombectomy for stroke. As a brief history, stroke still remains the fifth leading cause of death in the United States according to the latest numbers published from the CDC in 2021. Stroke, traditionally at least since 1996, has been treated with intravenous TPA, and up to date still remains the only approved medical treatment for stroke. However, in the 2000s, there began trials and for other treatments such as endovascular treatments for patients presenting with acute strokes. These included trials for mechanical thrombectomies using mechanical devices to retrieve the clots with stent-like devices or aspiration-like devices. These did continue throughout the 2010s, and ultimately, landmark trials demonstrated efficacy with mechanical thrombectomy, in addition when combined with the traditional medical treatment of intravenous TPA. So as a quick example, let's discuss a patient who received mechanical thrombectomy for an acute stroke. We have here a 48-year-old male. His only history is high blood pressure. He awoke suddenly at home in the morning with weakness on the right side of his body, and he was unable to speak. Quickly, EMS did arrive for help, and he was brought to the emergency department. Because his last known normal was prior to going to sleep, he was outside of the traditional window, however, to receive the intravenous TPA. Urgent imaging done in the emergency department demonstrated an acute occlusion of the left internal carotid artery within his neck. As you can see on the right side of the screen, the blood vessel is no longer filling compared to his normal blood vessel, which is seen on the left side of the screen. In addition, he had what we call a tandem occlusion. This means he had a blockage within his head, and highlighted within the yellow circle is his blood vessel called the middle cerebral artery, which also included a clot and a blockage. So in addition, because this patient was outside of the traditional window to receive intravenous TPA, he did receive what we call CT perfusion imaging. This is all in an effort to get a better idea of how well he is a candidate for mechanical thrombectomy and endovascular therapy. On the left side of this screen, the purple parts highlight parts of his brain that may have suffered irreversible damage from the stroke he is currently having. The parts highlighted in green demonstrate the part of the left side of his brain which may be salvageable and recoverable if we are able to open up his blood vessels. So given the large degree of brain which may be salvageable compared to the small size of his potentially irreversible stroke, we decided to move forward with endovascular therapy and mechanical thrombectomy. So you see here are the endovascular images with injections into his left common carotid artery. The image on the left demonstrates a complete occlusion in the internal carotid artery, which is the branch towards the right side of the image. On the right side of the screen, you see the injection after we're able to open up the blood vessel, which demonstrates a patent and flowing left internal carotid artery. After we were able to open up this blood vessel, we turned our attention to the further distal blood vessels in his head, which did confirm he had an occlusion of what we call the left middle cerebral artery, highlighted with the yellow circle. After we were able to perform our mechanical thrombectomy, we were able to successfully open up the left middle cerebral artery, highlighted with the image on the right side of the screen, which demonstrates patent flow to the blood vessel and to the distal territory. And both of these openings in the blood vessels were accomplished through using what we call a mechanical stent retriever. And you can see highlighted here with this device is how we trapped and pulled the clot from his intracranial space. And you can see it attached to the stent retriever there. So this is a quick study in a case which demonstrates timing and really saving perfusion and blood flow to this patient's left side of his brain. You can see the before study in the perfusion scan, which the purple part again demonstrated parts of his brain which may not have been repairable despite our intervention. However, the green part was his potential size of his stroke, and you can see on the right side is an MRI. The highlighted parts on the MRI demonstrate his final burden of stroke, which is very different compared to the green part highlighted in the perfusion imaging. So overall, this patient, we were able to successfully open up his tandem occlusions in his left internal carotid artery and left middle cerebral artery, and really salvage the majority of his left cerebral hemisphere. As a result, thankfully, the patient quickly improved in his condition, and he was quickly discharged from the hospital without any lasting deficits. And as you can see here, this case demonstrates endovascular therapy for patients with acute stroke utilizing mechanical thrombectomy. Thank you for your time. I'm Mickey Smith, and I'm one of the neurosurgeons at Houston Methodist, The Woodlands.